now tuned in to the Cold Hard Truth, Cayman's #1 hard-hitting live podcast show, where we feature some straightforward conversations on political, social, and celebrity news and all things happening in the Cayman Islands and around the world. This show was created to give the people a voice and a means of being involved and informed without any filters. Sometimes it gets crazy, but we always keep it real. We bring you the tea, piping hot, so grab your favorite beverage and join the conversation via WhatsApp at 324-1612. Email tips at CaymanMarlRoad.com. Now, here's your host, Sandy Hill, broadcasting live from the beautiful Cayman Islands.
Good evening, Cayman. Good evening, everyone. How are you? Hope that you guys are doing well. We are here this evening with Premier Panton. I'm just giving him a few minutes to jump on to the live stream. As you guys can appreciate, he's probably had a rather full day. So in case you missed it, folks, this is the start of what I think will be an absolutely fabulous segment where he's going to be joining us every other week to answer your questions, to talk about whatever it is that you want to talk about, whatever's on your mind. So we appreciate him being open and transparent and willing to come on the program to answer all of your questions live and direct.
The Cold Hard Truth now has your Premier access with Premier Panton.
Hello everyone, this is Wayne Panton. Come and join me on Cayman Road's Premier Access every other Wednesday at 7 p.m. for a frank and open Q&A session. I'm here to answer your questions about the issues that concern you the most. Tune into YouTube and Facebook Live on Wednesday. We will see you there.
Full transparency answering your questions. Down to earth, accountable, and accessible to who matters. You. Don't miss Premier Access on the Cold Hard Truth, spilling the tea like no one else.
All right, folks, it's going to be an evening segment with the premiere every other Wednesday. So it's this Wednesday and then not next week, but the week after that. Sometimes there might be a little bit of scheduling going on because, as you are quite aware, the premier is obviously very busy. He's got Parliament starting on Friday. So there will be occasions when, we'll adjust the schedule as needed. But good evening to all of you. Thank you guys so much for tuning in. As you can see, I'm in a little bit of a dress down attire this evening. I was actually outside playing pickleball, my new love. I'm telling you what, I'm so excited about this whole pickleball thing. You know what? It's just an opportunity to kind of run around. I don't have enough yard space for like a tennis court or anything, but pickleball does it for me. And so we were out in the backyard just hitting the ball around and having a lot of fun. So welcome to Wee Wee. Thank you so much, Mr. Robert. Olivia's here. Marlene is here, Mitzi, Kay, and at least another 100 people. I see all of you online, so let's not waste any time. As some of you have sent in your questions beforehand, and I do have those ready to shoot off to the premiere as well. But let us join together, do a virtual clapping of hands, and welcome Premier Panton. Good evening.
Good evening, Sandra. Good evening to all your fans of your show. Good to be on an evening show. Joining you here. Unfortunately, it means I have a bit of a 5 o'clock shadow. That comes with doing an evening show.
Yes, well, we appreciate you coming on. I know that we've got you scheduled for 2 hours, but of course, if we finish up and we run out of questions before then, we will definitely get you out a little bit quicker so that you can get home to your family and hopefully get some rest. So Kay
More
says,
about
good
getting
evening.
to other work, not so much.
Yes, Kirby is here watching.
So much work to do, but anyway.
Kirby's watching from the Philippines. Diana's here.
Wow.
King made it. King, what time is it in the UK? 1 o'clock in the morning? King said he would be here, and there he is. There's Hero Blair. Dawn has got it locked in. Good evening to Wendy. Good evening, Kay. Andrea's here. Wee, of course, and Diana. And like I said, we've got at least 110 people already logged into the program. So let us start with you giving any sort of general comments, and then we'll get right into the questions.
Good. Well, thanks again, Sandra, and thank you to all of the people who have joined, wherever you are in the world. It's always refreshing to know that Caymanians who, even if you're away, you're interested in what's going on in your country, and that's a wonderful thing. You can't take the country out of you. And
yes.
So we have the start of Parliament, the delivery of the budget on Friday, and we'll be then doing budget debate early next week. And I'm not sure of the timing, but probably towards the end of the week, we will then move into Finance Committee to deal with the actual budget details specifically and go through all of those. Right. So that's something that, people, not everybody is always interested in the specific details, but at least I encourage them to listen to the headline statements, whether you're on the opposition side as well or the government side.
Right. So this is an important process, and the budget has required of your government a lot of preparation. Am I correct in saying that?
Yes. Well, I mean, it's always a lot of preparation, no matter which government it is. But it takes in truth, it takes months and weeks to do the budget, and of course, I think since about 2017, 2017, there was a transition into a 2-year budget cycle. So the last term we've had a full 2-year budget cycle, and that's continuing now. So our budget presentation is going to be in respect of 2022 and 2023. So up to the end of 23. So yeah, there's a lot of work. The civil service, the Ministry of Finance, everybody has to put in a lot of work. And the tail end, in particular with the Ministry of Finance, those folks work really, really hard, and they almost have to bring in their cots and sleep in their offices to get everything sorted out. So get us there and ready. It's the same thing all the time. There's a lot of work, a lot of effort that goes into it.
All right. Well, we'll certainly be tuned in and listening for some key indicators of how the country's moving forward. So Olivia is out of the barn with some questions. And like I said, I do have some other people who've sent questions in advance as well. So Olivia says, good evening, Mr. Panton. My question to you is, if the hospitality sector workers don't find employment, how they're going to pay their bills when the stipend is discontinued?
Well, the reality is that we are not going to have a very clean restart to tourism and reopening, that sector of our economy. There will be some choppiness, there will be some bumpiness, and we have certainly anticipated that, and we know that some people will need to continue to have some degree of support as we move forward. But we are, this government's intention is to try to make sure that as opportunity is returning to people, they continue to be supported until they don't need it again. So we're not going to stop making payments to people at December 31st. We are going to continue to provide some support going into 2022, and hopefully that means that we will have increasing opportunity, increasing levels of tourism and job opportunities returning to center stage for the tourism aspect and part of the economy, and people need to engage and pursue those opportunities, because that's what we're about as a people. We're about succeeding. We're about driving ourselves forward and being a part of the success of Cayman.
Okay, all right. So Olivia, hopefully that answers your question. Sidian, good evening. Lavona is here. Good evening, Lavona. Thank you so much for joining. And Lavona, by the way, let me just express, I don't think you've been on the program since the tragic loss of another family member of yours. So please allow me to, whilst you're here, to publicly express my condolences on the loss of your niece. I know it's been a really hard time for your family, generally speaking, over the last month. And I would dare say over the last couple of years, you've lost some family members. So, we were so sorry to hear of the tragic loss of your niece, which was so incredibly unexpected and shocking.
Yes, indeed. That was very tragic.
Yeah.
The family has obviously suffered quite a bit of losses recently. So they've had more than their fair share of difficulties. And so I certainly would like to extend condolences to all the family, particularly on the loss of such a precious young lady, as that young member of their family that passed away.
Yeah, just so tragic. Elizabeth, thank you so much. She says that she's watching. So Darlene has a question. She always starts out her questions with the statement, with no disrespect. She says, I hope the tourism stipend will not be taken from our people until they find work. So I think that's been answered, unless they plan to take it and have our people begging at NAU steps. I think that has already been addressed. Thank you. Myrta Dilbert says, question for the Premier. Back in April of 2020, Dr. Lee presented COVID-related projections, i.e. deaths, etc. I would like the Premier to advise if this information is still valid, as the death toll for the Cayman Islands was projected to be around 900. Do you know much about those predictions that were presented back in April of 2020?
Obviously, I wasn't a part of the government at that time, and I doubt that there was specific, public presentation of those projections. But the circumstances were entirely different then. That
Mm-hmm.
would have been, prior to the development of the vaccine, all of the vaccines, I should say, plural, because we have quite a few very effective vaccines right now, which are approved in Cayman as well. We have only been using the Pfizer and the AstraZeneca here, and the majority of that, the vast majority, probably 99% is the Pfizer. But those projections would have been prior to any real effective treatments, prior to having the vaccine developed, and it was. I remember listening to Angela Merkel um, back in, I think it was late March or April of 2020, and I remember her doing a presentation to a statement to basically the people of Germany, and on the basis of her projections, I did some back of the envelope calculations that we would be losing between 700 and 900 people a year in Cayman. So my back of the envelope calculations were somewhat similar
Mm-hmm.
to Dr. Lee's, but obviously that was all based on the knowledge that existed at that time, and the fact that there was no effective vaccine. Now the world has changed quite significantly. We have not just vaccines available, which obviously the government has been promoting very heavily. Both governments promoted very heavily since January of this year, and we have certainly made a huge degree of progress. And I would again always take the opportunity to thank the people of Cayman who went out and got vaccinated, and that needs to continue as well, obviously, so that we continue to get those benefits. But we now have additional medicines. We have the Merck pill, which will hopefully be available soon. There is also a pill apparently being developed by Pfizer, which is still in the testing phase. And I think that is projected to be even more effective.
Mm-hmm.
That's projected to be almost, or let's say, similarly effective to the vaccine courses. So it's there. Things have changed a lot. There are lots of other medications available as well, which we do have here in Cayman. Also, we have the cocktail of um, antibodies, monoclonal antibodies that are very effective when taken early on. So the world has learned a lot about this disease and the treatment of this disease, and we have a lot more tools available to us to control it and to help people avoid getting sick, minimize the risk of death. So we've moved on a lot further from those initial projections. Clearly, we do have people here who are very sick, and that is the sad part of it. Is that with all these things that we have available to us to avoid people or minimize the risk of people getting sick, we still
Mm-hmm.
have, unfortunately, situations where people make decisions not to avail themselves of those options to try to you know maintain their health and avoid getting sick. Uh,
Mm-hmm.
losing any Caymanian is a very difficult thing for many of us, and um, I can tell you for myself, it's any of us who understand the pain of loss um, will be able to relate to the prospect of having to relive pain like that, and it is just simply not something that you want to really think about. But we have so much options available to us. The country is in a good position from a vaccine perspective, but we need to be even better because we still have lots of people who are vulnerable. We paused our move from phase 3 into phase 4 of our reopening plan in September because of the concern over the outbreak in Georgetown Primary School. Um, So we were concerned about our children then. And obviously, one of the things we have learned firsthand is that our children are very resilient, but we do need to try to continue to minimize any risk to our children. But we also, I think, have learned that we still have significant pockets of people who are unvaccinated and who are vulnerable. So the Pines is a situation is an example that we would dearly love to try to avoid those types of situations occurring.
Mm-hmm.
A few days ago, we had the disclosure that a number of people were admitted to hospital. There was a significant number of admissions to hospital who were of elderly people.
Mm.
That is a very sad situation, and a number of those folks have been found to be unvaccinated, and the ones who are vaccinated have been doing better. Have been
Right.
faring better physically. And you're really, really concerned. I mean, there was a gentleman that was sort of saying his wife had been encouraging him to get vaccinated, and he had been ignoring her and not doing it, and he was basically regretting the fact that he had not taken her advice and not followed her encouragement to go out and get vaccinated when she did.
Mm-hmm. Let me ask you in relation to, since you mentioned this is a question that came in via Facebook. So this person had a few comments about the elderly. So they sent this at 4:53 p.m. They said, "Hi, Sandra. Please, can you ask the Premier why such a low vaccination rate has been accepted at the Pines, with the residents being the most vulnerable persons on island? Why the Premier expects us to vaccinate our 5-year-olds once approved, yet allowed 90-year-olds with comorbidities to go unvaccinated, and why the Pines wasn't locked down when community spread was first identified? And finally, why there are no daily LFT testing going on there, allowing 10 residents to be infected, and when my 2-year-old has had to do daily LFT testing for the past 18 days of this month." So the general question is really what's happening at the Pines. Is the Pines owned by government? I wasn't too sure about how the management.
No, the Pines is an independently run organization,
Okay.
and home service,
Right.
care service, and I'm aware, or I've been advised that they do have a fairly robust policy dealing with protections around their clients, who, yes, they are vulnerable, obviously. But there is a certain reality here, Sandra, in that you can only do so much. You need many times these folks need their family members to consent to them getting vaccinated. Some of them are just not in a position to make those decisions for themselves. And I don't know the full circumstances, but I would imagine that it may have been something along the lines of family members just not deciding not to have their loved ones vaccinated for whatever reason. But the important point is, it is not an organization that the government owns or controls. It is independently operated. There are facilities that government obviously has more control over, and there are specific policies in relation to those. And so far, I don't think we've had any difficulties with those. Some very strict policies have been in place there for probably at least the past month. But it is a it's a sad situation there, and I'm hoping that it gets resolved without any of the residents getting very sick or paying too high a price.
Right.
But it's not something that can be. I don't think we can tell them what to do. It's an independent organization.
Okay. And just to, the person did share a response. Seems like they sent it to the management or the directors at the home. And Pamela Webster replied and said, "Thanks for your supporting community concern with the Pines. I assure you that the board and CEO had begged the families who refused vaccinations to please do so. They brought in doctors, church leaders, speakers, and every resource, and without law, really could not kick them out, or with compassion, never would, the patients, that is. And I also assure you that every PPE protocol is followed. Please bless the frontline workers. They love and adore our beloved vulnerable patients 24/7. And I was there over 20 hours this week as a board member and saw firsthand the strict protocols. And let's pray and give love." And I have to wonder, I mean, one of the things that hasn't been clear about the Pines is whether or not the employees who work there are all vaccinated or not, because I know that at least one of them over the weekend had tested positive. And it's unfortunate, because again, there's such an incredibly vulnerable community that I hope now that one of the protocols in place, well, I think they've locked it down now, but anyone who wants to visit should be doing a lateral flow test before having access to
Absolutely. Those are the types of things we would encourage. I mean, and it's not just in that context, as you know, in our last press briefing, a lot of emphasis was put on the fact that people are going to go traveling, particularly the weekend that the border, that the quarantine envelope was removed for vaccinated travelers. And we know people are going to go off shopping, and it's their first time off the island for some considerable period of time. And we want people to be very careful coming back and recognize that they may pose a potential risk to their loved ones, to those people around them, in their families, and in their communities who are vulnerable. So we ask everybody has to do the 2, 5, 10-day lateral flow tests, but still exercise a degree of caution and limit your involvement, limit your potential exposure to people who are vulnerable, whether they're young people or whether they're elderly family members or community members.
Yep. Denny has a question. Denny says, "Good evening. The EU recognizes natural immunity. Why is the Cayman Islands not recognizing natural immunity?"
We may get there. I don't know at this point. One of the things is that we have not had, the same kind of experience the EU has had. Other countries in the world have had. We for 14 months or so, we had no community transmission, and that I think has left us in a situation where we don't have anything resembling natural immunity. So natural immunity is something that there's still some uncertainty about. I think we may get to a point, particularly because of the level of local transmission and case numbers that we're having, we may get to a point where we are in a position to perhaps recognize that someone who has recovered from COVID, say for a period of 2 months, they're going to have some degree of natural protection. But there is certainly no guarantee. I'm aware of so many people who have gotten COVID twice. Both people just recently here in Cayman, and there was a friend who left Cayman in 2020, went to the States, got COVID. It was I think they got sick to an extent, but recovered well, and then 2 months later got COVID again and ended up in hospital in a very serious condition. Recovered eventually, but it is just something that you don't believe that recovering from COVID is somehow going to give you this extended protection from COVID. The reality is, use all the options that are open to you. If you recover from COVID and you haven't been vaccinated, go and get vaccinated. It's only going to add to your level of protection that you have.
And let's be very clear, I was actually just having a look at this EU certificate that he's making mention of. So this is the EU digital COVID certificate. So basically they recognize three things. They recognize a vaccination certificate, obviously, a test certificate, and a certificate of recovery. And so that's 3 different types of COVID-19 certificates that they recognize. In the EU, digital COVID certificates are issued and used in all member states to facilitate free movement during the COVID-19 pandemic. So in other words, people can move from one member state to another for travel purposes. Now, of course, Europe, I don't know that they're the best example at the moment to be talking about, because they are the worst. They're getting, I don't know if this is wave number 4, wave number 5, I don't know what wave we're in, but as it goes at the moment, Europe actually has the worst outbreak right now in real time of COVID-19. So Euronews says, the headline today, 11 minutes ago, COVID in Europe, France is deteriorating as Italy is looking to lock down again. COVID cases rising across the European nations, and PAHO, the Pan American Health Organization, is issuing warnings. It's a dire situation, I think, the world over, but Europe in particular is having a bit of a situation. So, the UK is talking about a potential lockdown even before or during the month of December for Christmas. So
Boris Johnson has said that he's not ruling out the possibility of that.
Right.
So
yes,
that is.
Yeah.
But I do think that they seem to be in a sort of better position than other parts of than other, I shouldn't say other parts of Europe anymore, since they're not part of Europe anymore, but than the European countries.
Mm-hmm.
But it's still a serious situation, even
right.
with with the levels of even with the historical experiences, and the drive to vaccinate people that has been ongoing there for so long. They're still having a lot of problems, and we frankly are in a much better position because of the effort that we've put into driving up the vaccine rate here in Cayman. And I know I've heard so many people say to me, I'm tired of hearing you talking about getting vaccinated, but my view is I'm going to keep saying it. I don't care how tired you are. I'm going to keep saying it because I don't want to lose anybody. I don't want to see people getting sick and dying unnecessarily. And let's face it, we are where we are now. It was never going to be a situation where we could avoid having COVID in the community.
Mm-hmm.
There have been discussions from back in July, with people saying, the opposition were saying reopen on September 1st. Our plan was a phased reopening, which effectively began on the 9th of September, with still the controls in place. The quarantine envelope was to be in place until the 14th of October.
Yeah.
And of course, we paused it, and then we've gotten to the point now where we're in phase 4, and we've dropped the quarantine envelope for the vaccinated travelers. So we're 5 weeks behind in terms of where we had intended to be. But in any event, it doesn't matter what it was, we were always going to have COVID back in the community. You will remember some of the earlier press conferences where I kept saying the same thing. Folks, please go out and get vaccinated because we are going to have COVID back in the community.
Right.
I don't like the level that we're at. We're at a level of transmission that I think we can bring down if we all work together. We just have to adhere to the mask protocols, the social distancing protocols, and sanitizing our hands, particularly masks. Don't go into closed rooms or enclosed areas with big crowds, and not wear your mask and try to social distance. We can bring the number down. I think the latest number was 176 positives, and it is ticking down ever so
daily
slightly.
Average, I think. Yeah.
The average is ticking down ever so slightly right now.
Right.
I want to see it start to come down significantly. I want to see those numbers come down to below 100 on a daily basis, and then once we're below 100, I want to see that eventually cut in half again, so we're down into the 30s and 40s. That's the sort of target that I want to see us accomplish in the coming weeks. And I think we can do it. Cayman can do it. We know how to do this. We just have to be disciplined about it. We have to work together, and we can make this happen, Cayman. It's for all of our benefits. We're people that are kind and caring, and we look after each other. We welcome guests. This is just one more thing we have to do to make sure we look after each other and our guests.
And folks, let's put it in perspective quickly in terms of what is happening across Europe. These are some of the latest figures. So we have, according to the BBC, at any rate, the World Health Organization has just issued the alert again. Regional Director Dr. Hans Klug warned that 500,000 people, so that's 500,000 more deaths, could be recorded by March unless urgent action is taken. He said an increase in mask wearing could immediately help. So again, people are out there not even wearing masks. It's just unbelievable. So several nations reported record high infection rates and introduced full and partial lockdowns. He said some contributing factors include the winter season, insufficient vaccine coverage, and the regional dominance of the more transmissible Delta variant were all behind the increase in the numbers. So he called for an increase in vaccination uptake, the implementation of basic public health measures, and new medical treatments to help fight the rise of COVID. So he said mandatory vaccine measures should be seen as a last resort, but that it could be very timely to have a legal and societal debate about the issue now. And of course, again, the numbers and the mortality rate for the region is skyrocketing. Austria just on Friday became the first European country to announce that COVID-19 vaccinations would be a legal requirement, and the new rules are set to come into force in February. And of course, you know, they also did a national lockdown, and there's some other things that are coming. Countries like the Czech Republic, Slovakia have announced fresh restrictions on unvaccinated people, as record infection rates are recorded across the continent for them as well. So not a pretty sight. Germany Health Minister Jean Spahn described the situation as a national emergency and refused to rule out another national lockdown. And the UK recorded 44,242 new coronavirus cases on Friday. So just to put that question in perspective. So let's move on to your questions. Thank you, Denny. Ms. Della says, why is the World Health Organization, not been kept up to date with our island's COVID-19 status? I'm not sure I understand that question. Why wouldn't
I think perhaps she means that they don't have an updated indication of our case numbers, perhaps. I don't know.
But how do we, in terms of reporting protocol, don't we send that to PAHO and WHO?
As far as I'm aware, yes.
Because I mean, you know, even if you do a search online, it comes up in like databases almost daily. It's updated up to November 23rd, what the new cases and stuff are. So I'm not really sure what that's all about.
Yeah.
I mean, I'm looking at, what website is this? This is new cases per, this is even Wikipedia has it at 6,091 with 4 recorded deaths. So that's at least fairly recent within the last couple of days.
That's
okay.
Pretty accurate.
Yeah. So World Meters as well has it at 6,283, recovered 2,234. And then the numbers did come out right around 6 o'clock this evening, folks. So again, as of 8 a.m. this morning, so they've been doing it kind of like up to 8 a.m. in the mornings, Dr. Lee has reported another 176 positive cases, with 175 being from local transmission. And there are 28 COVID-19 patients who are hospitalized at this time. Okay, questions. Diana says that she got her booster shot this evening. Well done.
Thanks, Diana.
Sanya, thank you for tuning in. She said, good evening, my most honorable premier. Thank you for that statement. As we in cruise tourism are in trouble, mostly the older ones like myself who find it challenging to find work. Thank you very much. Any thoughts on, Sanya brings up a point. I mean, obviously some people are being retooled. We talked about this morning with the Minister of Tourism and Transport when he was on the morning show about some of the training opportunities that are being made available, through his ministry and otherwise, bartending courses and other things.
Yeah.
But Sanya, I'm going to guess she's probably in her 60s. Sanya, I hope I haven't aged you incorrectly. But, she's a grandmother. She's been doing taxi driving and bus operation for some time.
She's a young 60.
She's a young 60, yes. So how do you bridge the gap? Like, she's saying that she's having a difficult time. I think she's also mentioned previously that she's been in a few courses and stuff already, but she's having a hard time getting employment. And I think this is something that it's weird, but young people face this sort of like almost age discrimination, and older people face it as well, where a lot of employers don't want to hire someone of a particular age.
Yeah. Well, and it's for different reasons,
Yeah.
Some of the people who are on the older side, I think sometimes they feel that their expectations are greater, so they don't want to consider taking them on. And people who are on the younger side, they sort of say, well, you don't have enough experience. So unless they have the specific experience and the specific training, they don't want to give them the opportunity.
Mm-hmm.
Obviously, there are people who present themselves as more mature and experienced people who can handle situations in a calm manner and understand what it's like to be able to deliver great service, etc. We can train people to do that, and this is what we have wanted the tourism industry, the big stakeholders in the tourism industry to be doing. And this is, they made promises to us that they were going to engage. They tried to do certain recruitments, they said, which weren't apparently that successful. But frankly, if you do recruitment online, you're going to miss a lot of people. So this was, we were at a point in time several months ago where, it was a lot easier to do in-person recruitment. We could have been doing it then, and doing it much more effectively and giving more opportunities to our people. But we're going to maintain the position that as we continue to open up and make progress with restoring the tourism economy, that our Caymanians have to continue to come first in getting those opportunities.
Yeah.
I mean, there was never a question that we were going to go full steam with tourism, both in terms of the numbers of people coming in and the opportunities. I think everybody anticipated there was going to be a slow ramping up. Yes, there are people who will look at the numbers now and say we'd like it to be higher, but obviously for us as a country, being able to transition more slowly into regrowing our tourism industry, restoring it, is not a bad thing. It allows us to learn where there are glitches and there are issues to deal with, and be in a better position to handle them with lower consequences than if we suddenly had this huge rush of people coming back. I personally believe there's a lot of demand out there for Cayman, and I think people had bought into this perception that somehow this government was not going to be willing to take the chance of going ahead with the reopening and removing the quarantine envelope for our protected and vaccinated travelers. Clearly, we have established now that we are a government that is delivering what it says it's going to deliver, and we are moving forward. We're addressing a lot of the concerns and issues. Yes, there are some teething problems, but I'd rather have those teething problems now, as I said, with this gradual ramp up, than if we were in a full-blown rush of people coming in the door and having to deal with that problem then.
Mm-hmm. Okay, thank you. We do have some cruise ship related questions, so we'll do them both at the same time. So Amy says, on what basis are you welcoming back cruise ships in December 2021 under stage 4 of the reopening plan, when previously you indicated that there was only going to happen under level 5. If you're prepared to relax certain aspects yet again, can we request you to relax the restrictions for those Cayman Unit residents with young children?
Yeah.
Cruise ship passengers seem like a far greater risk with very little benefit to the island. And there was another question, so let me just read them sort of in conjunction with each other, that said, Sandy, my question is about the cruise ship booking. Why are the ships allowed to sell all local tours? This is a slightly different question, which most times leaves taxis with no work. They need to change. Only buses get work. Hopefully this government will put Cayman first and change this. So 2 separate questions. I think it was CMR that broke the story last night, that we understand, again, the government has not officially confirmed this, but we understand from reliable sources that a ship is coming in towards the end of December.
Okay, so I believe, I haven't seen it myself, but I believe an official press release has gone out.
Oh, okay. I haven't seen it yet.
That there is an agreement to allow a cruise visit under very strict circumstances. Basically, all this particular visit it falls within the general theme of the approach that the government is going to take in terms of a strategic approach with cruise, and that is to go with lower quantity, higher quality experience, and developing a tourism product and a cruise tourism experience that is much better than the high volume shoulder to shoulder crowded days type of approach that has been done in the past. I think the country wants that kind of approach, and I think we can engage with that sort of approach in a much more successful way, and have it deliver more for the country with less of the negative aspects. However, we have not fully developed that yet, but where we're at right now is this particular opportunity was presented in a quite a unique way, in that the vessel will be making its first stop in Cayman, Grand Cayman. So it is not going to any other country. It is leaving its port of embarkation in Florida, and it is coming direct to Grand Cayman. All passengers are vaccinated. I think there is one person who has a medical exemption, who I think is also handicapped, but will not be disembarking, will not be coming ashore. So all crew, all passengers are vaccinated. There are no unvaccinated children, and this is going to be, they're in for 7 or 8 hours, and then they leave and go on to their next destination.
Right.
The reality is they're going to get PCR tested, just as we do pre-flight PCR testing for Cayman to come here. They're going to get PCR tested. Then when they reach the ship, they're going to get a lateral flow test as they board. And anyone who tests positive obviously is not going to be allowed to board. And then it comes straight to Cayman. So it is within a quite a tight and protected envelope, with no opportunity to stop in another country or another port. I know if you look at the details on the website, it doesn't show quite that, but this is a presentation we've had, and this is the basis upon which we have agreed that this vessel can make this stop. What this does for us is it allows us the opportunity to, in a small way, have the experience of having cruise visit come in, very controlled circumstances. The normal capacity on the ship, I think, is about 2,655 or somewhere thereabouts.
Yeah,
So there,
666.
yeah, okay. So my memory's not exactly on, but it's close enough.
Not far off.
Yeah. So they're running it at about 60% capacity, maximum of 60% capacity, which is about 1,600 passengers. That gives them a lot more space to spread out. They will be wearing masks on the vessel when they're not in their staterooms, and or they're, obviously if they're sitting at their tables and eating, they won't be wearing masks. But if they're moving around indoors, they're going to be wearing masks, other than when they're in their own staterooms or on their balconies. So there's a lot of protocols around protecting the passengers, limiting the opportunity for any infections that may be present, and it's with the testing, with them coming on board, and the short period of time they'll be at sea before they make one short stop here. I think the risk has been significantly reduced. We've had discussions with our medical advisors here, and the view is that we think this is a risk that is very manageable. So it's on that basis that the vessel has been allowed to make this one stop. That's obviously a very unique situation, and I don't see that happening. I can't say nobody else will ever try it, but I don't see that happening on a significant basis at all. And certainly it is not. Our approach to this is that it is a unique opportunity, and it's a one-off for us to reintroduce cruise, and to our folks that haven't seen that, haven't been involved with it since March of last year, and it would be a good way to identify what we have to do in order to re-engage and get the necessary protocols in place to successfully move forward, when we do this, in the coming months.
So please excuse me, folks. I'm going to allow Kevin to take over in a co-hosting capacity here for just a little bit. I've got a break-in story that must go up immediately on the website. You guys are going to be floored by this, but give me about 5-10 minutes to get that up. So Kevin, sorry, we'll be asking your questions starting with Philip, and the ones that have come through on WhatsApp, I'll attempt to send some of those through, but we've got an unbelievably breaking story here. You guys are going to be shocked. Give me a few minutes. Let me get it up, and then I'll be right back. So Kevin, you can go ahead and take over with Philip.
Thank you, and good night, everyone in Cayman. Good night, Premier Panton. How are you?
I am good, my friend. How are you? So fantastic to see you. I see you wearing your Cayman, your Grand Cayman pendant there.
Yes. Thank you. Sandra just messaged and said she had breaking news, and so I was like, oh my goodness. Yeah.
She's scaring me, she's telling me it's going to floor people. I'm like, well, don't you want to tell me, you want to warn me on the side if I'm going to get floored? I don't think it is, but I'm hoping it's nothing serious.
Yeah, she didn't even tell me what it is. She says, Kevin, I just need the help, so I'm here to jump on in. But let's go back to the questions, because we want to make sure that we get to the questions from the people here that have a lot of different things that they're asking. And so Philip is asking, can the Premier say what is happening with allowing people 18 and older to get the booster shot, particularly the children coming back from university and are now 6 months past their last shot?
Well, Philip, thank you for that question. It's a good question. We now are at the point where we're allowing people down to 40 do the booster shots. To be frank, I think that, and I've had discussions with the governor, and he's willing to help support us in our position that we'd like to make them available to anyone who has had the double vaccination and who has gone past their 6 months to get the booster shot. So I can't guarantee it at this point. Obviously, we are very grateful to the UK for giving us and making these vaccines available to us, as well as the booster shots. And I think, there's a good chance that they will agree to, allow us to expand the booster shot program. So I'm really, really encouraging everybody who qualifies right now, who's able to go out and get the shot right now, please go and do it. I will tell you that it is, for some people, it has no impact. For some, it does sort of set you on your bum for a day or so, and that's what it did to me. But it is very, very worth it when you consider the level of protection you get from COVID, serious COVID illness. It is absolutely worth it. It is too late to think about it once you're very sick and you regret not going out and doing it. So please, folks, go get your boosters. We're going to continue the discussions with the governor, and he will continue interceding on our behalf with the UK. And I'm very hopeful that we'll be able to expand it even further from where we're at right now. So the same approach really is going to happen in relation to the vaccines for children between 5 years and 11. We are what's happening in respect of that is that we're waiting for the UK MHRA, the regulatory authority, to approve, to make a decision as to whether they will be doing that in the UK, and then we will, if the answer is yes, then we will hopefully benefit from that. We'll get the supply of that particular kids version for our young kids, that and families that want to avail themselves of that will have that available to them. Now, one other possibility is if we can get access to a source outside of the UK, we may be able to make that available in Cayman outside of that, outside of the UK supply. That's something that we may be prepared to do if we can get access to it. The problem is that, as you know, Kevin, it is very difficult for even big countries, but much bigger countries than ourselves, to get access to a reliable vaccine supply. Even though our quantities are small, it is just not easy when you're competing with many other countries out there who have been, going through vaccine, what we would call, or what I would call, vaccine desperation, when they're trying to get sources. I mean, I've had some of our fellow Caribbean countries call up and say, "Can you sell me 100,000 doses of Pfizer or 50,000 doses of Pfizer?" And I said, "Well, we at that time I think we hadn't even had 100,000 doses of Pfizer in total." So, participating in the CARICOM heads of state discussions and meetings, it's very clear that a lot of our Caribbean neighbors are really desperate to get a reliable vaccine supply, and this is one of the incredible benefits of our relationship with the UK, which we absolutely have to continue to be thankful for. But we want to be able to get the booster program extended, and we want to be able to get either through the UK, or if we're able to find a source through the US, for example, or somewhere else, access to the approved, the FDA approved children's vaccine.
Absolutely. And I know you touched about your experience getting the booster shot, and I was able to benefit of getting the booster shot here in the US. And because, again, we do have a little bit more expanded ability to be able to offer it to more people. So I was eligible. And so, again, it put me out for about the day, but I am absolutely happy. And I felt so much better that I had it. And I want to encourage anybody, my age or older, everyone needs to really consider getting it.
Sorry, if you saw the lights go off here, it's because they go off at 8 o'clock. It wasn't that somebody forgot to pay the bill, but I had someone arrange to go and turn them back on.
Perfect, thank you. So
that's usually my cue to go home. But
it's like, okay, yep, time to go. You're working. You're starting to really work a little later. Yeah. Okay, so we got Kathy asking, a lot of people, a lot of places in the world still has to shut down, even having the vaccine to help control the virus. How can anyone here guarantee that we will survive the outbreak without implementing further restrictions, people are naturally not abiding because there's no strict accountability.
Yeah, we have seen some examples around the world with countries that are highly vaccinated and who have run into difficulties, who do have outbreaks going on. I can't really think of one that's really highly vaccinated that has had to go into lockdown, but they have had difficulties. They have had outbreaks that they've had to reimpose certain restrictions. I mean, let's take Gibraltar as an example. That was a very highly vaccinated fellow British overseas territory, and they they started having an outbreak, even though I think they were something like 90 something percent vaccinated. Um, as usual, you have to look at some of the details, right? So my understanding with Gibraltar was that they came out. They were like one of the first overseas, probably the first overseas territory to roll out vaccines, and they got that rolled out very quickly to their entire population. So they're in a period where their vaccine efficacy has started to wane. Um, then you have the reality that they have a land bridge with Spain, and there's 10,000 people a day crossing that land bridge to come to work in Gibraltar and then going back home. So there is the introduction of significant risk there as well. So they have had difficulties, and they're having to impose some controls, stricter controls there. We I don't anticipate that we're going to be in a position where we are going to have to impose any real significant measures, including something akin to a lockdown. But to be perfectly honest, and you will know this, Kevin, it comes down to how seriously our people take their own personal responsibility and their responsibility and contribution to the community as a whole. If we do not try to keep ourselves safe and utilize our masks and and minimize the opportunities for risk and avoid situations which are risky, we are going to continue to have um, community transmission, and we can have significant spikes of it. There's just, it's we don't have a significant portion of the population with booster shots. We have a considerable number that have gone past their 6 month period. We also still have a significant number that are unvaccinated, and then of course we have somewhere in the region of about 10,000 children that are not capable of being vaccinated, and they're very effective. Um, they're very very resilient, and they don't tend to get sick, but they can get infected very quickly and transmit it very quickly because of the level of fun loving interactions that children have as usual. So we have to continue to be cautious. We have to ramp up our ability to control this community spread, and we are only going to do that by taking personal responsibility and thinking about others as we go about our daily lives and activities.
Absolutely. Got someone that sent on WhatsApp and who wants to remain anonymous, but it's asking, mask wearing is so important. Why are offices open? Why are offices with open plans exempt from mask wearing and left to make their own policies, essentially only requiring employees to wear a mask if moving about the office while not at their desk?
Well, I mean, I think in an office scenario where people are sitting at their own desks, you tend to have a natural social distancing situation. And if they're sitting there working, then the risk that they are emitting and adding to the amount of virus in the air will be a lot lower. Obviously, if they're doing a lot of talking, then in those types of scenarios they should be wearing masks. But we leave that up to the businesses to work out their own particular risk profiles and have them put in place policies which may ensure that their staff and the environment that they're providing for their staff to work in and for customers to participate in is as safe as possible. They're the best ones to be able to work out exactly what kind of policies would work best for them, and they have an obligation to their employees. They have an obligation to any visiting customers or clients to ensure that the environment is as safe as it can be. So we haven't done anything in the way of mask mandates because we think that people can be responsible and they're able to make the best decisions which reflect their particular circumstances.
This question from Robert, not sure if this is going to be a question you could answer tonight, but how many, if any, have contracted COVID twice or more and did contact tracing get carried out on them?
I can't tell you how many. I'm not sure that it is a number that anybody specifically tracks, but I am aware of at least a handful that I can think of that have contracted COVID twice, and I would expect that more often than not contact tracing is done, but we are at a place where contact tracing is a lot more difficult because of the significant volumes, and you have to rely more on people to accept, as I said, the personal responsibility and maintaining the compliance with the public health protocols like mask wearing and sanitizing and social distancing. This is a respiratory disease, and you are primarily going to contract it by breathing in droplets or micro droplets that are suspended. And mask wearing in particular when you're indoors and when you're around other people is the right thing to be doing to protect yourself. And if you are an individual that is going to be doing a lot of talking, wearing your mask while you're talking is going to protect other people, because if in the event that you are yourself positive. So if we're all doing this, it minimizes the opportunity for the virus to spread, and we're all going to be in a safer, healthier place, and that is what this government cares about.
And many people, whether they know me or not, they just for everyone's knowledge, I do work in public health here in the state of Florida. I work for the Department of Health. Well, next week's my last week, but either way, and I can tell you that our case investigators here have investigated situations where people have had it at least up to 3 different times throughout the course of the pandemic. I don't know of anyone personally more than that, but I do know so far at least 3 times. And so it's not a great number, but it is certainly possible. And I know earlier you were mentioning that you personally know somebody that's had it more than one time and stuff as well. So it's certainly, you don't have full immunity after getting infected. And so it's so important to, strengthen that protection by getting vaccinated.
Yes, absolutely. Absolutely. I think there's been a narrative that, for some people that natural immunity is something that is ironclad, and once you've caught it, you're not going to catch it again. That's just not the case. I can tell you of a young schoolboy in Cayman who has had COVID twice now in the space of about 2.5 months, recovered from it and then caught it again and had worse symptoms the second time around. I gave the example earlier of a friend that I know that moved back to the States, got COVID, didn't get really sick, recovered, and then a couple of months later caught it again. That was towards the end of last year, and got very sick after that. So this is not something for people to take lightly, and I'm going to always continue to encourage people to go out. If you're not vaccinated, go out and get vaccinated. This vaccine is safe, and it is approved, and it is going to work. It helps you. It minimizes the risk, doesn't eliminate it, but it lowers the risk that you're going to get infected, and it significantly lowers the risk that you are going to get sick and possibly die. I can tell you there are many households in Cayman that I have observed over the past weeks where we've had one person in the household who, and oftentimes it's a child who is positive, a child who's obviously by definition unvaccinated, and there are 2 or 3 other adults in the house, parents included, who are all vaccinated, and they go through the full period of recovery with the child, and they don't get it, they don't catch it. And in my mind, there is no doubt that being vaccinated helps in that respect, as well as it helps significantly in preventing people from getting very sick.
So we have Amy is saying if the UK is mandating vaccinations for frontline workers, is this under consideration for the Cayman Islands or if for the entire adult population as in Austria?
Well, I don't think we need to be in a position where we are considering mandatory vaccinations for the entire adult population. Our position and our experience is a lot different from Austria's. I think Austria, they're still around mid 60s in terms of vaccine distribution. So that is a difficult position for them. We're in the stage that we're at, where we're 83%, 82% first shot, and nearly 80%.
Seems like we might have lost the Premier for a little bit. Let's see if he will get reconnected. His internet might have went out. Let's see. Let's see where.
Hopefully, it's not a situation where they disconnect him because he's been working too long.
It could be. I just messaged him to see what was going on, but
yeah.
But Sandy,
all right, well, let's talk about.
News?
Yeah, I mean, while we're waiting on the Premier to reconnect, I can now share the breaking news with you guys. I'm sorry, I was getting it in the middle of the show, and I wanted to have an opportunity to sit down and actually put it up on the website. But folks, Dr. Stacey McAfee from UCCI has resigned as president of the university.
Interesting. Did they state why? Did she state why, or?
She just says that she's doing it with a heavy heart, and she talks about a lot of her accomplishments. But of course, you'll know that just 3 days ago, I don't even know if it's a full 3 days yet, we had talked about the fact that she was seeking to keep her position at the university, a position that is well paid, and there was some friction between herself, allegedly, and the board of directors. And so it's quite interesting that on the heels of that story, we now hear that she has made the decision to not seek to renew her contract, which comes to an end at the end of December. So she said that her and her family will be leaving then. And she talked about a number of her accomplishments whilst in the position. So we'll definitely talk about that probably the morning show. Ironically, we have other UCCI stories that were in the pipeline that we were working on, and we will still put those stories out there because I think it's important that people perhaps move forward with a certain degree of understanding of what was actually happening at the university. But yeah, that's the breaking news that I went to work on. Is that president of UCCI sent in an email, folks, at 7:30 this evening, saying that she is resigning. So hopefully the premier can come back. There's so many questions that have come in for him, and I think that we'll have to bank some of them until the next time. We have been getting some on WhatsApp as well. Let me just see if I can reach him on WhatsApp to see if he's able to jump back in. I think people are so anxious for this opportunity to ask him questions that obviously when he comes on, the 2 hours will probably barely be enough. You know what I mean?
Oh, absolutely.
So
well, while you work and seeing if you could get him on, I could just highlight some of the latest data that came in.
sure.
And so I know you kind of highlighted it earlier, but I know some people might have joined and might not have heard it. So the latest report is that there were 1,139 PCR tests that were carried out, and this is as of 8 o'clock this morning. And of that, 176 positive cases came out. And it says that one of these positives was from a traveler. The next 175 were from the community. And so the Cayman Islands now has 4,140 active cases. So a lot of people are out there that have that are going through COVID right now. And so they also said in the report that as of 8 this morning, there's 122,920 COVID vaccines that have been given out in total. So that represents about 81% of the population, which I know that's where it's been for quite some time. That's 57,874 with at least the one dose. And then for those who are fully vaccinated with their 2 doses, that's about 78%, which is 55,751. And then we continue to increase the numbers of individuals who got their booster vaccine, 9,739 people, which is about 14% of the population. They've gotten that 3rd dose, which is the booster vaccine. So, you know, as eligibility expanded, more and more people are taking up that opportunity to get their booster shot, which again, the premier not too long ago mentioned the importance of getting it. I know I have personally gotten it, and I'm very happy that I did. I encourage all my friends and family to get it once they are able to, because it's definitely something we need to do to be able to protect one another. It's what we have to do to be able to get on the other side of COVID and be victorious, so where we're not having to worry about COVID really impacting the community and our lives quite as much as we try to get this thing to be endemic instead of a pandemic. But Sandra, did you get on to Premier Panton to see?
I haven't received a message, so let me just try a phone call.
Okay. So Sandra's going ahead and trying to get on to the premiere, and we'll just kind of take a look at what's going on in the Sister Islands, because that is also important. We do know that we have some folks in the Sister Islands that are definitely watching. And so it says, as of 8 this morning, Faith Hospital confirmed that there were 14 active cases in Cayman Bracken and Little Cayman. One COVID positive individual identified in the previous 24 hours. So there was just one new case over the last 24 hours, and 94 people in the Sister Islands have recovered from COVID. So that was the details from the Sister Islands. And I am for the lateral flow test. A lot of people are reporting, which you're required if you have a positive test. With a lateral flow test, 1,691 positive lateral flow tests were reported on Wednesday, the 24th of November. So that was the latest update for people reporting lateral flow tests. So again, a lot of COVID activity going on in Cayman, but which is not really, something that is really, we knew that this was going to be happening once community spread was established. And so, if you were following any of the CMR COVID spotlights, you would have heard from experts, explaining that this would eventually happen, and again, those who are unvaccinated, you're the ones that are a little bit more at risk, and so it's something that we really, really encourage people to get vaccinated, because again, even look at our own local data. Don't even need to look at the world data, because Cayman now has its local data. It shows that those who are hospitalized in our own hospitals tend to be unvaccinated a lot more than those who are fully vaccinated, and those who are vaccinated and hospitalized, they tend to be folks that are also going through a lot of other health challenges. And we can't say that enough, because it's something that we just want people to really understand, and really make that change, and get vaccinated, so we could protect more people. So Sandra, any luck with that phone call?
Yes, Kevin, he is having some technical issues with the internet, so we're trying to see if we can get him back. If not, we may have to just bank the remaining questions until the next segment.
Okay.
Yeah.
So we'll, if we want, we could probably
you can probably read some of these are comments as opposed to questions. So maybe we can go through some of the comments and then make a note of the questions, and then next time we'll have a whole slew of questions ready for him.
Sure. So let's go through them here. Olivia Ebanks, it says Kathy, okay, she's replying to someone that commented earlier. I know people who are COVID positive and not isolating. I called HSA to report on Saturday, and the response was public health is not open on Saturday. So yeah, no, that's one of the things I've heard, that that goes to that personal responsibility as well. Two people are not necessarily doing their part to lower the community spread. But then we do hear from the other side that people are reporting and not necessarily, not hearing what, there's not a lot of follow-up on that. So it's definitely a question we would love the authorities to be able to really reply to. I'm not sure if public health would be the ones to respond to an isolation breach. That might be more, I guess it would be a joint initiative between that and law enforcement. So it would be, interesting to hear why and what exactly the protocols are, and to really follow up on that. We also had someone saying, it was good night to the premier. I would like for you to look into Travel Cayman. My mother is a Caymanian living in New York, and she wanted to come here to look for me, her son and grandchildren. But for some reason, I have been trying to get through to Travel Cayman about her travel certificate, but they're not listening. They just sent her an email that her travel has, I guess, is being approved, but the certificate was not attached to the email, and I was trying to let them know. So yeah, we've heard quite a bit of complaints on Travel Cayman, so it's something we definitely would want to follow up on, and hopefully we could have maybe someone in the future from Travel Cayman come on one of the shows. I know they've been having a lot of different challenges with different things, but we'll definitely see if we could get on to someone from Travel Cayman to offer some feedback with some of the challenges, and maybe some more process improvements.
And let me just say, Tahir, why don't you just send me a WhatsApp number or WhatsApp message, sorry, with your mother's name and, obviously I'd see your contact number and just some details about her travel. And let me just see if I can get on to Travel Cayman directly. I've had quite a bit of success helping people with some Travel Cayman related issues. So perhaps if you send it to me, this isn't something that we necessarily have to get the premier involved in, but I think he is aware that they have some growing pains. And I think they've also been really inundated with people who are wanting to travel now that phase 4 has been introduced. I mean, I'm shocked at just seeing the numbers, with Cayman Airways, all the flights are practically full. And a lot of people are applying, and yeah, it's probably more than they expected. So the premier might have to look at, hiring some more staff for that particular department. Yeah. So, yeah.
Yeah. Well, there's one of the questions that came in, natural immunity. It was one of the things that came up, and so I'm scrolling through some of our old videos from the CMR COVID Spotlight, and I guess maybe we should play one of the explanations that came up. I'm loading it in here, so I'll go ahead and add it to the stream just to hear from the experts on that.
This is really interesting. This is comparing vaccine conferred immunity, the fraction of people who are immune because of the vaccine, and the fraction of people who are immune because of natural immunity. That is, these are the people who got infected, lost the infection, and recovered and became immune. Most of the immunity in Cayman Islands, 79% currently, about 80%, are due to vaccine-induced immunity. Only 3% is coming from infections. And that is a testimony to the very strong social measures which were practiced in Cayman Islands. So social measures, protected the susceptible people, but the problem with that is they remain susceptible, right? They got very little infections. So very little acquired immunity coming from natural infections. Most of your immunity is vaccine-induced. Now, this is very interesting because latest reports are saying there might be differences between vaccine-induced immunity and natural immunity.
So that was one of the things where, earlier in the show, someone had a question regarding, natural immunity, if it's better than vaccine. And so the expert in that show was kind of highlighting some of the, natural immunity versus vaccine immunity. And then we did have someone asking if all COVID beds at HSA is filled. Based on the latest numbers, it's not. And they also have the ability to increase capacity by quite a bit by opening up the Family Life Center location. And that
and I think they have that plan for early next year. So
Correct.
The Premier extends his apologies, saying that unfortunately, even after restarting his computer, he was not able to get it to come back online. And so he's looking forward to joining us again in a couple weeks' time. So Kevin, why don't we make a note perhaps of just some of the questions. So Carol says lockdowns are useless. They're going to be doing it every winter. Nicole says, are we waiting for all 55 beds to be filled before we go into lockdown? Well, I guess, Nicole, refer to Carol's point that maybe lockdowns are actually useless. I mean, there's two ways of looking at it, right? I don't think that we're anywhere near considering being locked down at all. As Denny said, we are in wave 1. So as the vaccine becomes more readily available for a lot of younger persons, perhaps we'll see that impact our numbers as well. So Kevin, in lieu of, or in light of, I should say, the Premier not being available, I think what we'll do is we'll ask people to obviously come back with your questions. We do have some that had come in WhatsApp and private messaging that we did not get an opportunity to ask him, so I'll save those up for next time. And folks, do remember that he will be back with us. This is going to be a bi-monthly segment. The audience participation was wonderful tonight. Always more questions than we could ever handle. But, keep the questions coming. And then the next time we will definitely, oh, here he is sending his apologies. We will definitely keep those questions, and we'll, pass those along. But yes, I agree that travel time is probably having some staffing issues. Travel Keyman, sorry. Slow, even when they're the ones who approve a person to come in, not a good look, says Loretta. So yeah, so I think that is something to definitely take into consideration. King says, who blackmailed that lady now and got her to resign? She might be worried about that audit report that's going to be coming out here shortly. Anyway,
yeah,
folks,
it'll be interesting to find out more of the behind the scenes on that one, Sandra.
Yeah, don't worry. We'll get all this stuff just in time for the morning show. Kevin, thank you so much for being a trooper and being willing to jump in. Really, really appreciate that this evening, so that I could get that story up.
No problem,
so that all of our viewers will know what's happening in the country as it happens. So again, folks, you've been listening to a segment of Premier Access, And we hope that you will join us again on today's the 24th. So that will be the 8th of December will be the next Premier Access segment. So start to think about, what questions you have for the Premier at that time. Kevin, have a wonderful night.
Good night, everyone. Take care.
The Cold Hard Truth now has your Premier Access with Premier Panton.
Hello everyone, this is Wayne Panton. Come and join me on Cayman Mar Road's Premier Access every other Wednesday at 7 p.m. for a frank and open Q&A session. I'm here to answer your questions about the issues that concern you the most. Tune into YouTube and Facebook Live on Wednesday. We will see you there.
Full transparency, answering your questions, down to earth, accountable, and accessible to who matters. You. Don't miss Premier Access on the Cold Hard Truth, spilling the tea like no one else.